is Hutton Harmon here with an update. It's been 2 weeks since my AC joint grade 3 separation repair surgery, and overall I'm feeling really good. Some of the changes that have taken place is I'm completely off of any pain medication. Pain was never a problem. I didn't even take any of the oxycodone prescribed. So I just want to shout out and give a thanks to Dr. Freeman because he must have done a great job with the surgery for me to adapt to a pain-free lifestyle that quickly after surgery. So thank you again. And today I had my follow-up appointment with him. We x-rayed the AC joint to just take a look at the reduction and just make sure that everything was in the right place. And it went well. It went excellent. Basically, the reduction is back and secured my clavicle back to its natural position. So essentially, the thing is all fixed up. Now I still have 2 weeks left wearing the sling. And as you can see, I'm also wearing the shoulder brace, which just kind of helps keep everything locked down and stabilized. So I'm going to be wearing this for 2 more weeks, which was I initially thought I was going to be wearing the sling for 4 more weeks, but I'm glad that I can come out of the sling in 2 weeks, and that's when I will begin physical therapy officially. So I'm very excited for that. I have been able to sleep, sometimes at night I take the sling off, if it gets in the way, but I've just been getting in the habit because I'm at the last 2 weeks now of wearing it, so I might as well sprint through that gate, and just double down on all the precautions I can take so I don't mess it up. But everything's been going very good, and I'm very grateful that I can at least go into I've been going on the treadmill every day, Monday through Friday. I do 4 miles on there. Sometimes I'll do like 2 miles walking, 2 miles at a light jog. So that's been very great. I've been maintaining my regular diet, so I'm not really, doing any like limitations or anything. I'm eating a full dinner, and I've been maintaining the same weight. If anything, I dropped like 2 pounds, but I'm considering that was probably some muscle and just I from when I was reducing my diet a little bit, I probably did cut a little bit of fat there too. So I'm just maintaining my diet. At night, I do a light workout on my right side just so I can minimize the atrophy to just this area. And that's been working out well. I mean, I'm not getting any pain when I do any of my activities now, so I'm just grateful that I can participate in some type of activity because when you get this type of injury, that's the main challenge that you're gonna have to deal with is like the depression of like not being able to do anything. So my only advice is just figure out what you can do, and hopefully if you have a good successful procedure that doesn't really make a lot of invasive changes to your body and it won't affect the repair, then just do as much of that as you can until you're able to finally get moving again. So where we're at from here is I'll remind you, I got 2 more weeks in the sling, and then after that I will begin the physical therapy. So I'm just taking it easy. I'm just going to ensure that I don't do any more damage to this area until then and just let it heal. Today they took off the suture tape that like kind of locks down the stitches and everything, and they trimmed the stitches up a little bit. The incision site looks really good, like it's a thin line, it's not like a big thick like gap. So hopefully when that scars, it won't be too big of a scar to deal with in the future, but it is what it is. I'm just glad that I got the thing repaired. So I'm just going to maintain to the exercise and diet plan that I'm on, get enough sleep, make sure I'm getting plenty of sleep. The supplements I was taking, just as a reminder for anybody that's dealing with this, I was taking my normal protein, so I take about 50 to 75 grams of protein powder, and then I also have additional protein from the food that I eat. And then I have a collagen peptides supplement that I'm taking 3 times a day. And that's just to help support, any type of regenerative like healing for the skin and the muscle and the tissue that needs to be provided for that repair. So I'm just sticking with that. What will be next is I can't wait to get out of the sling, and then I'm gonna try and get some motion going in my arm. I have no really pain. Of course, if I try to I'm not supposed to lift my arms above like shoulder height. I'm not really supposed to be doing that, so of course that gives me a little bit of issue. But overall, I have some minimal function, basic function with this arm. Um, it's just about keeping weight off of it to not mess up the repair. So I'm definitely going to treat that with respect and not make that mistake of doing that. And I'm just overall, just as a summary, I'm feeling great. So I'm going to be doing the updates on a weekly basis, I guess, now. And eventually it will be bi-weekly because there won't be much to update until, until I start making progress with the physical therapy. And I really am not worried about the range of motion coming back because I can just feel it. I don't feel any barricade from my arm. It doesn't really feel like I had major surgery. So I know once I go and put that in use, and I'm probably going to lose a lot of strength in that arm from not, training it and using it as much. But I just think that's a good indicator that I will get that range of motion back eventually. And if you've seen some of the other short videos I made, some of the activities I'm doing, I'm basically, returning back to the lifestyle that I had before. So it's just a short update. I hope that if you're dealing with this injury, you make it this far and it's going as well. You definitely just want to be patient and realize, that it is going to be like a 6-month turnaround before you start to kind of leave this all in the dust. But if you chip away at each phase, it's going to make it easier to deal with, and it's going to make it more effective of focusing on what is the most important thing to be doing at that time. So that's it for now. I'm going to get ready to get on the treadmill and get my little cardio exercise in, and then have some lunch later, and then do a little bit of weight training. So I'm glad for anybody that's watching, and good luck if you're dealing with this yourself. And I'll see you in a week. Thank you.